You got it.
Perfect. So, hello, ladies. Welcome. Thank you all for joining. I'm Tracy Milgram Posner, the founder of BRCA Strong, where we inspire, empower, educate, and advocate previvors, survivors, and thrivers to eliminate the feeling of isolation and help you feel whole again. During COVID-19, we are sending out packages to our members who are just diagnosed, who are starting surgery, who are starting therapy, or going in for surgery. We're here to support you in any way. So if you have not received a package, please feel free to reach out to myself, Tammy, or Kate, and we'd love to get a package in the mail to you. Tonight, we have Dr. Simran, special guest tonight on BRCA Strong, speaking about her personal journey, her mom, who is an ovarian cancer survivor, and her previvor journey, as well as being a physician and a mom. And I want to thank you so much for coming on to educate the community, as I know I've spoken to you prior to your journey and have watched you every day on your mission. And I'm so glad that if I had to be part of a community, this is the community that I'm a part of because of the educational parts that we offer that are not offered anywhere else. So thank you so much for taking the time out of your day. I know your husband's a physician, you're a physician, and you also have two little kids. So we're super grateful for your time and commitment to coming on tonight.
Sure. Thanks for having me. So I'll just start by saying my name's Simran Malhotra, as Tracy just said. I'm a mom of two. I have a 3.5-year-old daughter and a 2-year-old son. I am a BRCA1 previvor, and Minnie is my mom. So she's actually just recovering from a cold. So I'm gonna kind of merge our two stories together and just kind of walk you guys through our journeys. And in between all of that, I'm a palliative care physician with an interest in lifestyle medicine. So I'm gonna give you guys some tidbits on what I do for a living and what some of my passions are in this space as I've kind of traversed this whole BRCA journey. So my mom's actually a 2-time breast cancer survivor. And an ovarian cancer previvor because she had the preventative surgery. So as a palliative care physician, I listen to people's stories for a living. And so stories are very special to me because they remind me of how far each one of us has come, particularly in the very tough times. And many times our stories are very sad or parts of our stories are very sad and scary and require us to be vulnerable, which can be very difficult. And this is the part of life that I usually share with my patients because most of them are very, very sick. And many times I think these stories are the root of all human connection. They allow us to feel closer to each other and to empathize with each other. And more importantly, why I've been so open in sharing my own personal story as a doctor, but also as a patient, is because there's someone out there who has a story very similar to mine, and they may learn something from my experience. And in the same way, over the last several months, I've met a lot of people. Of course, my mom is there, but I've met a lot of people outside of that who have really helped me shape what my journey has looked like so far in terms of the BRCA mutation. So thank you, BRCA Strong, for having my mom and I here today to share our stories. Feel free to jump in at any point. This is very informal, but I'll get started with saying that cancer and my family were first introduced to each other when I was 13 years old. My mom was 33 at the time, felt a breast lump. She went to her doctor with concerns of that lump, and her doctor basically told her, "Oh, don't worry, you're too young to have cancer. It's all good." So then after that, we went to India to celebrate my mom's parents' 50th anniversary. And at that point, she has 3 older sisters. So she told her 2 sisters that she's close with, I found a lump. They took her to 2 different doctors. She had 2 different biopsies, and both of them showed that the lump was cancerous. So needless to say, she's 33. She has a 13-year-old and a 10-year-old. We're halfway across the world. Everyone was basically in shock. So we decided to go back home to Canada, and she had another biopsy in Toronto, which confirmed stage 1 triple negative breast cancer. And from there, she had a lumpectomy, 6 weeks of chemo, and 12 weeks of radiation. her genetic testing at the time came back negative. And so I'll take a pause there. Her testing came back negative, and that just goes to show, and you'll see as I talk more about our story, why we decided to get retested, but that just goes to show how far, medical technology and the world of genetic testing has come, especially when it comes to BRCA1 and BRCA2. So yes, it really sucks to have these mutations, but if you're going to have the mutation today in this time is a really good time to have it, because they know so much more about it and they can do a lot more than they could when my mom was 33. So in the following years after that, after her tests, after her chemo and everything, she ended up going into chemical menopause because of chemo in her mid-30s, ended up with pretty severe depression, which she battled for many years. And I think she had a lot of family around her. We're Indian, South Asian in background. And so we lived in a joint family with my dad, his brother, his kids, my grandparents. So she was surrounded by family, but I think that was the one point in her life where I can probably say, looking back now, that she was the most isolated she's probably going to be for her entire life. She was a young South Asian mother of two with cancer. And that, especially in that time, was only something that was discussed behind closed doors. No one in the family encouraged her to talk to her friends or go to a support group or anything like that. So again, I think my journey at 32 is so different from her journey at 33, where I have this world of support from the internet, from people I don't even know reaching out to me, helping me through my previvor chip, whereas she was completely alone. And I think in the South Asian culture, along with many other ethnic cultures, it's very taboo to openly discuss sickness and disease and death. And so it's just something that, my family didn't encourage my mom to do. And at the same time, I don't think they provided her the support she needed going through what she went through at the time. I don't know, Mom, do you want to say anything, or I'm kind of speaking on your
No,
behalf?
it was hard. Definitely, whatever you're saying, it's true. It was very, very hard at that time, 15, 17 years ago. Yeah.
So fast forward kind of several years, I decided to pursue a career in medicine. In 2013, I was a second-year resident, got a call from India that my mom's older sister, who we were very close to, she was 58 at the time, admitted to the hospital with nausea, vomiting, and they found fluid in her abdomen. I knew enough at that point, as a doctor in training, that free fluid in the abdomen is not a good sign. And so I was worried she could have cancer. And she eventually was diagnosed with primary peritoneal cancer, which is an aggressive subtype of ovarian cancer, which is almost exclusively seen in people that have a genetic mutation. And so after multiple surgeries and chemo and everything, she passed away a little over a year later. And after what happened to her, I started asking, and at this point, I was already, a medical resident and in training. And so I knew a lot more than I did, obviously, when I was 13. And so I started asking more questions about our family history. I discovered that there was a lot of women on my mom's side who had breast cancer, who had reproductive cancers. Some were alive, some had passed away. And the youngest female on her side was in her early 30s when she was diagnosed with some form of reproductive cancer. I can't give details because, again, because of our culture, it's been so hard to extract this information from our family members. They just don't give us any of the details and don't like to talk about it. So we have, to date, my mom and I are the only one to have gotten genetic testing at this point. When I first found out in 2015 about my BRCA positive results, I reached out to my 4 older female cousins on my mom's side, and none of them wanted to hear anything about it. They felt like it was pretty aggressive to talk about preventative surgeries and all that stuff. So they weren't really interested in surgery. As a doctor, this was something that I struggled with because I had this wealth of information and my cousins just lost their mom, and I just wanted to share all of this. And what I learned was everyone's on their own journey. you can support, you can give information, but if someone's not ready to receive that information, then you just need to, respect that and walk with them on their journey while you walk yours. And that's okay. And it's interesting because one of my older cousins just had her baby, her first baby. And all of a sudden, after she had her baby, she called me and my mom and she's like, I need your paperwork. I need to know, what the doctors are telling you, all this stuff. So it's interesting when someone's ready to get tested or make that decision, it's just a matter of when that click happens. And I'm sharing this because I feel like a lot of us in this space with genetic mutations, when we find out about ours, we want to kind of spread that information to everyone in our family, knowing that they can be affected. But that can be a really difficult conversation to navigate. And I've heard that over and over again in these support groups that I've been a part of. So I just thought I'd put that out there.
And just to add to what you're saying, I have two older sisters that are just not interested. One of them has tons of different autoimmune diseases, but neither one of them are interested in getting the genetic testing, even though I've had ovarian cancer twice. And my cousin, who's usually on these calls with us, she's battling breast cancer. She just had her mastectomy. So we checked the mutation. Her and I have the same exact, it's really strange, but I talk to my sisters constantly. You guys should get tested. You guys should. No. I don't want to, I'm going to die someday anyway. I don't want to think about it.
Yeah. It's tough. It's a really tough space to navigate because you love that person and you know what bad could happen. So you want to try to protect them. But at the same time, if you end up being too pushy or share too much information that they're not ready to accept, you can ruin your relationship. So it's such a fine line to walk.
And as a doctor, so I have a question for you. One of my sisters has a million autoimmune diseases. As a doctor, does the gene have any correlation with that?
There may be another genetic mutation that maybe your sister could have that could predispose her more to autoimmune conditions. People that have one autoimmune condition are at higher risk for multiple autoimmune conditions, and that may be related to a genetic predisposition. I'm not sure 100%, but the BRCA mutations in particular are just related to breast, ovarian, and in less, but still pancreatic and melanoma.
Okay. Yeah. I'm just curious. She's got hidradenitis, nodular vasculitis, Crohn's disease, rheumatoid arthritis. It's
all
huge
sorts
list.
of things. Yeah.
All sorts of things. I'm you need to get tested for the gene. She's like, what difference is that going to make in my life? I'm sick all the time anyway.
I think, and that's just right. I think it's for describing what you're describing. I think she's already overwhelmed with everything she has on her plate. So now to know about BRCA and all the implications that come with it, can she handle it right now where she is in her headspace? It sounds like probably not. Because once you find out about it, and you're flooded with this wealth of information about next steps, and it's so, having been there myself, it's so overwhelming. So I think you just have to be in the right frame of mind to decide that, I'm ready for this. And when you are, it's just going to happen like that. So I think you're doing the right thing. You just keep supporting her. And then, when she's ready, you'll be there. You'll already be armed with all the information for her.
Well, and there's that trauma, right? For most of us who have family members, my mother died of cancer. I've had ovarian cancer twice. My grandmother had breast cancer twice. I have BRCA1 also. Everybody in my family dies of cancer. It's just so on top of the stress and the paranoia and the oh my God, I have this bump on my leg. Do I have skin cancer now? Or I have this weird pain? Is the ovarian cancer? But you're constantly, then you're dealing with all this psychological stuff and taking into account cultures and different family dynamics. I'm a single mom, I deal with it very differently because I'm dealing with it by myself. So it's just, it's there's no, one of the things that I think doctors don't talk about or I didn't experience was nobody talks about the psychology, how this really other than BRCA strong, nobody said. I had to see a psychologist once for my mastectomy, and it was 4 hours of talking to answering questions, and then I left.
Yeah. Unfortunately, that's partly why I went into palliative care, and I can touch on this a little bit later too, is that I felt like conventionally we're trained to make the diagnosis and then follow the algorithm for what's the next drug, what's the next test, what's this, what's that, but we treat the disease and not the person. And in palliative care, it's more of a holistic approach where you zoom out and look at the whole person. You know, a person is made up of physical, emotional, mental, psychosocial aspects. And unless you're treating all the aspects, you're never really going to move forward. So I hear you, because that's a big struggle with, I think, conventional medicine.
Yeah, I can imagine for you as a palliative care doctor and seeing what your mother went through and then getting this diagnosis psychologically, it's got to be very overwhelming.
Oh yeah, I can talk about that. For us, so just going back to kind of where we left off with my aunt passing away and with all the advancements in genetic testing, I told my mom to get tested. And this time, 15 years later, she was BRCA positive. And then so shortly after that, in 2015, she ended up getting a preventative total hysterectomy with bilateral self-angle oophorectomy to decrease her risk of ovarian cancer. And then in December of 2014, I was 26. I just gotten engaged. I was still in residency. And my fiance and I met with a genetic counselor to discuss genetic testing, which then told me I was BRCA1 positive as well. So just after that, I had my first screening MRI. And of course, as soon as it says BRCA positive family history, anything that potentially could light up needs to be biopsied. So right after that, I had my first biopsy. Luckily, it was negative. And then I graduated from residency in June of 2015, got married right after, a week later. And then we went to, and then I went to Hopkins to do my specialty training in hospice and palliative care. And so the last 4 years I've worked as an inpatient palliative care physician. And so what I do is I see people with serious illness. I help patients and families understand their disease state, help with complex medical decision-making, help with uncontrolled symptoms, and to help people clarify what their goals are. I think one downside with the medical field, but also in the general population, is there's a lot of confusion between palliative care and hospice care. And I'm bringing this up for a reason, and I'll tell you in a minute. Palliative care is for anyone that's diagnosed with a serious illness that's getting life-prolonging treatment, whereas hospice care is for someone who's believed to truly be at the end of life, which is usually measured in months. However, because most people still think palliative care is synonymous with hospice care, I'm usually not consulted until the very last days, weeks, or months of a person's life. And the reason I'm bringing this up is because over the last several months of being in these support groups, I have heard time and time again, you know, my doctor doesn't listen, I have pain, I have anxiety, I have chemo-induced nausea, vomiting, I have this, that, or the other, and I go to my appointment, they just tell me I need this test, and this is the next time I have my infusion, and then they send me out, but I have like a list of all these symptoms that are not being managed, and then that leads to decreased quality of life. And so I'm saying this, and I've said this in many of my support groups, is that if you are undergoing active treatment and you have symptoms, oncologists are good at treating cancer. They're not good at treating the whole person and all the side effects, but also the emotions and the mental and the psychosocial aspects that come with getting cancer. And so it might be something to consider if your cancer center has a palliative care team to ask for a consult to help with symptom management or to help with, you know, the emotional aspect or the psychosocial aspect. Palliative care is not hospice, two different things. And the reason I say it's important is because I got extra training to become an expert in symptom management. Oncologists and a lot of these other doctors are not trained to treat pain and pain-related constipation and all sorts of things. So it's just something I want to put out there, that if your cancer center has a palliative care team, use them, because most of the time they're like, I'm not saying that I'm a palliative care doctor, but these are really special people in medicine who look at the whole person. Were you going to say something, Kimmy?
No, I was unaware of that. Every time I've heard palliative care, I think of the deathbed, you know, and
yeah. And that's why I space also to spread awareness about that, because a lot of people have that misconception, and that's in the general population. Even doctors still believe it's the same thing, when it's really not.
Yeah. Wow. That's crazy.
But to your point earlier, you know, over the last several years, I've cared for a lot of young women who have died of breast and reproductive cancers, and some of them had the same genetic mutation as me. And this every single time has evoked a very visceral emotional response within me, to the point where with some of these patients, they were young, they had babies, I had just had my babies. So I was that person sitting with them and crying, because I literally felt what they were feeling, because of this mutation. Not to the point, you know, like, I'm not trying to say I know exactly what they were feeling, because I don't, but I could really empathize with them. But at the same time, in my life, that manifested as debilitating fear and anxiety. And so it's sharing this mutation with a lot of my patients has been a double-edged sword, because it gives me the ability to feel that empathy and deep compassion, but at the same time has really worsened my own anxiety. And so having said that, you know, I continue to work in palliative care. I love what I do, but my own personal health journey and my mom's journey has really opened my eyes and shifted my interests a little bit, which I'll talk about. So for me, the genetic counselor and the initial set of doctors that I met recommended preventative surgeries basically as soon as I was done childbearing, because of our family history and the onset of cancer so young. And so I was blessed to have two beautiful children in 2016 and 2018. I had them 19 months apart. And I got my screening MRIs in between breastfeeding both of them. And for a short while in that window, I put the surgeries to the back of my head because I was just in newborn bliss. So I did try to join in the support groups and all of that at that time, but I wasn't ready for it. Between work and new babies, thinking about surgeries and all that was really just too hard. But I knew as soon as I was done breastfeeding, I was going to start thinking about these surgeries. And so while that was all what was going on in my head, 2017 comes along, and we had just celebrated my mom's 15 years cancer-free. And she was here with me in Maryland. I just had my baby. And so she went back home to get her screening MRI, and then was diagnosed with breast cancer again at 49 during her screening test. So they found DCIS, which I guess can be called a precancerous lesion. And because of her cancer history and BRCA, they urgently advised for her to get a bilateral mastectomy, which she did. And she ended up getting the deep reconstruction in the summer of 2017. So I love to bring this point up because that screening MRI may have saved her life. The final pathology that she had after that surgery showed a 2 millimeter invasive cancer in the opposite breast that was not picked up on the MRI. And so after all that happened, she did have to meet with an oncologist and a radiation oncologist, and they both agreed that the surgery was curative because it was so tiny. But had she not been getting her screening MRI, it could have, because it was an invasive cancer, it could have rapidly progressed, and a year later she could have been, you know, a much later stage. So I'm really grateful that we ended up retesting for the genetic mutation so that we could get her on the annual screening MRIs. And then after she was diagnosed again, something shifted in me where I was kind of like, okay, I have this genetic mutation. My mom just got diagnosed after 15 years again. And at that point I was like, okay, what can I do? Because I had the biggest meltdown in my life. I was 6 months postpartum. I was breastfeeding. I was hormonal. She was just diagnosed and I just lost it basically. So I saw a psychologist and all of those things. But then what I did was, what else can I do to decrease my risk of cancer? Yes, I have a genetic mutation, but is there anything else I can do to decrease my risk? And that's when I immersed myself in the literature to learn about nutrition and lifestyle and its implication on people with genetic mutations. And it's something that I didn't learn about much at all in medical school. And I knew I could get the prophylactic surgeries, but my gene mutation increases risk of other cancers like pancreatic cancer and skin cancer. Granted, tiny fractions compared to the breast and ovarian cancer, but still, I can't take my pancreas out. I can't get rid of my skin. So what else can I do to even decrease my risk a little bit? And so then I read two books. One was How Not to Die by Dr. Michael Greger. And it is the Bible of evidence-based nutrition. This book changed my life. And that's after I already went to medical school, did my training. I'm a full practicing doctor. I learned about things that I'd never heard about, and it's all evidence-based. And then the other book I read about was Dr. Christy Funk's book called Breasts, the Owner's Manual. Dr. Christy Funk happens to be Angelina Jolie's breast surgeon, but her book gave me so many answers that I was looking for. And so what I learned in all of this was that there's so much evidence behind lifestyle medicine. Lifestyle medicine has 5 pillars, and the pillars that they talk about are diet, and the diet that they talk about is predominantly a whole food, plant-based diet, physical exercise, stress management, optimizing sleep, avoiding risky substances, and maintaining healthy relationships, and using all of these alongside your conventional treatments in treatment prevention, and even sometimes in reversal of many chronic illnesses and some cancers, but a lot of chronic illnesses that are plaguing this country today. Things like high blood pressure, heart disease, cholesterol, diabetes. And it's interesting because I've had patients who are cancer patients, but a lot of times in my world, my patients don't just have one diagnosis. They have cancer and they have diabetes and they have high blood pressure. So as I started recommending some of these things to my patients and even within my family, not only did people start feeling better, but their blood pressure started getting better, or they started dropping weight, or they, X, Y, and Z. And the thing that was, I think, the most amazing for me is that in palliative care, a lot of the patients I see feel like all of their control has been completely taken away. They go to the doctor and it's like, you have this test, you have that test, you have to be here at this time and that time. And they just feel like they don't have any more control over their life. And so me talking to them about these lifestyle interventions, things that don't necessarily cost money, things that they can do at home, gave them back so much autonomy. And so personally, we shifted in my family, my mom, my husband shifted to a plant-based diet in 2015 after finding out about my mutation. And it's led as a 2-physician household. We have a very stressful, we have very stressful careers. We have 2 kids under 4. All our family is in Canada. And after we made this shift with our diet, it's been crazy. More energy, better sleep. My husband, his blood pressure normalized. His cholesterol normalized. He dropped weight. Like it was all just magical. Yet this is stuff that I'd never heard about in medical school. So my interest right now, a lot of it lies in lifestyle medicine. I'm actually getting board certified. I'm taking the exam on November the 7th. And so I'm hoping I can use this knowledge to continue to empower my seriously ill patients to improve quality of life, but also maybe just provide longevity. So that's kind of professionally, I wanted to throw that piece of it in there because I think lifestyle medicine is also something, just like palliative care, a lot of conventional doctors don't know what it is and also don't appreciate the power of simple lifestyle habits. But I think that's super important.
When you say plant-based diet, you mean vegetarian or vegan? Like,
so there's a difference between a vegan diet and a whole food plant-based diet. A vegan diet can be Coke and French fries and Oreos because those things are all vegan, but they're also ultra processed, right? So when you're talking about a whole food plant-based diet, you're talking about a diet that is basically made up of unprocessed food, mostly fruits, vegetables, whole grains, legumes, and beans. And actually, the American Cancer Society just came out and said and the American Heart Association also says the same thing, is that a diet made up of those things is what's best for treatment and prevention of heart disease and cancer and all of these chronic illnesses. I think it's, whenever I bring this up, I get a little bit of pushback, especially in the community of people that have genetic mutations. And trust me, I have a genetic mutation myself. So I'm certainly not someone that's saying, if you do all these things, you know, I'm not going to get cancer. It's more so taking back some control over your life. And at the end of the day, when you look at the statistics, us genetic mutation carriers are only 5 to 10% of the population that get hereditary cancers, whereas 80 to 85% of the population, the breast cancers and the colon cancers, are mostly lifestyle related. And so as a doctor, I'm super passionate about it because the genetic mutation people are very, in terms of my patient population, is very, very tiny. Whereas the people who, you know, probably get it when it's more related to lifestyle is a very high number. So that's why I'm personally very, very passionate about it, because it's something that I think, unfortunately, especially in America, we have a pandemic going on right now, but we have a huge epidemic of chronic illness. You know, things like diabetes, high cholesterol, high blood pressure are now being treated in pediatric populations. And so that's actually a very scary thing, because people think in palliative care, you know, my patients are in their 80s and 90s, when in reality, my average patient's in their 40s and 50s. So I'm very passionate about talking about lifestyle, because it's something that is in our control and we can do in prevention and in treatment of chronic illness. Any other thoughts before I move on? So I finished breastfeeding last summer, and then had my last MRI in December of 2019. So we started interviewing breast surgeons and gynecs and plastic surgeons, and all of a sudden it became very, very real. The multiple doctor's appointments, the reconstruction versus no reconstruction, concerns about surgical menopause, and just at that point, I took a real deep dive into the Facebook support groups, which is the worst idea of my life, because it left me with really bad anxiety and fear, and so many questions that I couldn't answer at midnight on a Monday. So bad idea, would not recommend that to anybody. But I started grieving the loss of my body parts, but at the same time, remembered why I was doing this, and felt a deep gratitude that I was even able to make a decision like this when my mom wasn't able to. And so we started planning for surgery in June of 2020. I think my biggest frustration in those multiple doctor's appointments was doctors were just not listening. Genuinely not listening to what I wanted, which was very frustrating. And my husband and I are both doctors, so that didn't make us immune to all the things that, you know, are heard about with the healthcare system. And plastic surgeons telling me what I needed versus what I wanted was very frustrating. And so ultimately I decided I wanted to go flat. For a few reasons. I wasn't a candidate for a flap reconstruction because of my small build. That's why my mom had the deep reconstruction. And I was told by 2 different plastic surgeons that I should go on a donut diet for 6 months, which, for all the reasons above that I just stated, I was not going to do. And I didn't want implants because I didn't want multiple surgeries. I didn't want to risk the higher complication rate. And I was really, really tiny breasted to begin with. So for me, it just made the most sense to go flat. And then something happened. We hit a world pandemic, and in came COVID. And my husband, he's a critical care doctor, and myself, we became super overwhelmed with the sickest patients that we've ever seen in our lives. And all of a sudden, my job went from being at the bedside to doing end of life conversations over Zoom. And so all of a sudden BRCA fell to the back of our radar. Surgeries got postponed. My husband moved out for self-isolation for like 10 weeks. And then as things finally settled down in July, I went back to meet with my doctors again, and we scheduled surgery for the fall. And in August, I did a lot of physical, emotional, and mental preparation, which if you guys want me to tell you what I was doing later, I'm happy to do that. But I was really worried, like really, really worried about throwing myself into surgical menopause at 32, and what effect that would have on me or how it would change my life. Unlike my mom, she went into chemo-induced menopause. She already had breast cancer. She wasn't allowed to be on HRT. I was allowed to be on HRT. So I knew that was an option for me. And then on September 2nd, so 4 weeks Wednesday, I had a bilateral mastectomy without reconstruction and a total hysterectomy with a self-phago oophorectomy at the same time. I wasn't allowed to have anybody with me, so my husband dropped me off at 5:30 in the morning by myself. It was terrifying. Surgery was successful. I slept off most of that day. And then the next morning I woke up and the breast team evaluated me, and I was flat when I woke up from surgery. And the next morning it looked like I had B cup implants. So I had developed bilateral hematomas, or blood collections, under both my breasts. And it's probably a combination of the blood thinners and the ibuprofen. And so it was just not a great combination. And I was rushed back to literally emergency surgery. They saw me, and within, I think, 25 minutes, I don't even think I had time to call my mom and my husband at home. Within 25 minutes, I was back in the OR again. Basically, they had to drain the hematomas. They had to replace the drains. My nurse was fantastic. They had a 0 visitor policy, but she vouched for me. She talked to administration. They let my husband come in. I lost a lot of blood. I was super weak, but surgery was successful. And I had a lot of pain, but I was still able to go home the next day. And then I ended up having drains for 9 days, which was like the most painful part. And once my drains came out, I was more mobile and having less pain. And my pathology came back negative, which was like the most relieving feeling. I don't have words to describe it, but I felt very relieved because over the last several years, I've dealt with a lot of emotions when it comes to the term previvor. I've had a lot of anxiety and stress about getting cancer. I've had a lot of fear of dying because of my everyday job and talking to dying patients every day. And it was exacerbated by losing my aunt. And I had a lot of guilt for not having to go through everything that my mom did, or for what other women are going through right now. But then throughout this whole journey, I've just felt an immense amount of gratitude for even the ability to have a choice and to do everything that I've done and to be proactive. So I have a long journey ahead of me to continue to be there for patients and help them and guide them. And I think this whole experience of being a patient has totally changed my outlook on what my patients and families go through. So that's our journey. That's our story. Yeah.
Pretty heavy. But, so it's such a great testament to your work and what you do and your experience. I think so many of us, you know, when a physician goes through something like this, I think it's very different, because when they were talking to me, I almost felt like I needed a textbook to understand everything that was going on. So it took longer to process. But I can imagine for somebody like you, you're like, oh no, I know what this means. And I
There's
and I
information
understand.
overload. It's almost like I knew too much.
Right. Yeah. So I can imagine how hard that is. And, you losing your aunt. And I think a lot of us have experienced, losing my mom, sitting in the same rooms, waiting to be tested, and sitting around a bunch of people that their hair is missing and they look like my mother. And I just kept thinking to myself, this is her looking out for me somehow, some way. This is why I got this gene diagnosis, so that I could prevent anything happening, you know, to my breasts. And I'm in surgical menopause now. So, but they told me I couldn't have any hormones.
Yeah, you know, the other thing I've realized over the last several months is that even within this genetic mutation space, there's a lot of well, my doctor told me this, but my doctor told me that, and it's not very standardized. And I think a lot of it is because research, this is one of those spaces where research is ongoing, and there's just new information coming out every day. When it comes to HRT in particular, though, if you've already had cancer, it's a contraindication. So that's probably why they would not have recommended it.
Surgical menopause is no joke. This is like
I can only imagine. I mean, I've been on the estrogen patch for 3 weeks now. So I feel okay. I don't know. Like I haven't had any symptoms of menopause yet, but I don't know. Like my doctor said, we don't know if this is the right dose for you, so we'll just wait and see. But for people who are previvors and haven't had cancer before, there's been extensive research. Actually, the study I think was ongoing for 8 or 9 years, where they looked at BRCA positive women who had preventative hysterectomies, oophorectomies, and put them on HRT, and it did not increase their risk of cancer. So at this point, the way that they're going forward is that the risks of, you know, not having estrogen outweigh, you know, any risk of breast cancer based on that study. So
that's something that Tracy talks about often, there not being a standard of care, because as we meet women from all over the world, I mean, we've had people on these calls from Australia, you know, from different places, because it's still kind of a quiet community, you know. I never heard of it until I got ovarian cancer, you know what until, you know, it was just kind of like talking to my primary care physician, who in your family has had cancer, and he's like, oh, wait a minute, you have to get tested for this gene. And I had never even heard of it. So it's kind of like, there should be and some people, like I had, similar to your mother, I had the latissimus dorsi flap reconstruction procedure because I had a preventative mastectomy, and I still have trouble with motion, and everything is numb, and nobody sent me to a physical therapist or anything like that, and they cut into all of my muscles. Yeah. So
I know I can't even lift my arms yet, and I asked my doctor twice. I'm like, I really think I need physical therapy, and he's like, no, you're fine. I'm like, I can't lift my arms.
I feel like the plastic surgeon just like slapped some tape on me and was like, all right, next. That's what it feels like. They just kind of, it's like a factory almost. You kind of feel like.
So it's interesting that you say all that, because, and this is where, again, I feel really blessed that I had time to think about all this. You know, when you get a diagnosis of cancer, at that point, it's just go, 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 go. Like, you don't have time to research. You don't have time to talk to people. You don't have time to do anything. And so, like, the studies have shown that, you know, women that have prophylactic surgeries, or who have time, usually end up making a more of an informed decision than the women who were diagnosed with cancer and are kind of just nudged in a direction, like, this is just what the next step is. And I think that's one of the things that I fight for as a palliative care doctor. My favorite words are informed consent, right? So most of the time when I sit down with patients and families, they don't even have a good understanding of their disease state, let alone all the treatments that are being offered, or the risk benefits or alternatives of those treatments. And I think a lot of times, especially in the genetic mutation world, you know, people think that breast reconstruction after mastectomy is the same thing as breast augmentation for aesthetics, and it's so not. It's so different. You know, the way that things look after the risks, the multiple surgeries, the risk of complications, most women don't don't have a good understanding. The numbness, the lack of sensation, the need for rehab, like all those things, people don't actually understand those things. So it's really hard. And that's something that I fight for, when I talk to my colleagues and when I talk to my patients, even if it takes me like an hour and a half to sit down to make sure they understand what the risk benefits alternatives are of the procedure that they're going to do, then that's how long it takes me. But that's my job, and not all of my colleagues can do that because of our current healthcare system and all the pressures that they have. So, but it's really hard. Exactly what you're saying. I mean, I think my mom was just about to say something, and I think I know what she's going to say, but I'll let her say it.
No, I was asking when she had her surgery.
Oh, my mastectomy was like a year and a half ago. So
It takes time. It took me 3 years for the pain in my arms and my back, shoulders. I had a lot of shoulder blade pain. So it's getting better, but I did have physiotherapy and all that done.
And she did aqua therapy.
Aqua therapy helps.
Really?
Which obviously in the world of COVID is not an option right now, but.
Yeah, this COVID world definitely makes things so much more challenging just in general.
But I really wish I have gone flat too, because my stomach stitches are hurting me more than my breast.
Really?
She has chronic abdominal pain.
Mine is in the back because it was the latissimus muscle that they cut into. And that's, I think, why I have a lot of, it was weird because I used to have very large breasts. So I had to have a reduction first. And then I had the mastectomy and they rebuilt. And now this is going to sound like very weird, but I guess my body is used to carrying around so much weight up top that I have a lot of weird pain in my lower back, and it feel awkward. I don't know. It's very strange.
But it takes time.
Yeah. Recover. Yeah.
Is there any help available way down the road? It's been 20 years since mine, and I still have problems. I mean, every day. I never had any physical therapy. It's not something that was being offered at the time 20 years ago. Is it something I would benefit from still?
I mean, I think any form of stretching and strength training is beneficial to anybody at any stage. So I would say yes, it would be. And if anything, I would say try it. And if it helps, that's great. If it doesn't, you only got stronger, right? So there's no harm to it. I don't know, though, necessarily that if you go tell your doctor that it's related to your mastectomy, if it was 20 years ago, if they'll say, yeah, let's do physical therapy. I'm not sure, but you could always try. Most doctors are pretty lenient with prescribing physical therapy because that's usually the first line of defense with any muscular issues.
Well, I really hope that you as a physician and as you continue to educate people and tell your story and use your medical expertise, that we do create some type of standard or care for our community, because I realize we are still in the research phases, but so many of us are kind of lost in this experience. And it's great to have physicians that really not just see us as patients, but can truly empathize and understand the entire process, from the emotional strain and stress to the physical feeling. Because it's being BRCA positive is not, you can tell other people about it, but until you're diagnosed, it's definitely not something people are really understand.
Yeah.
It's constant PTSD, you know?
Yeah. 100%.
Well, I think we're at time, but I really want to thank you for taking the time to be with us today, for sharing your story, your amazing story, and for your mother, and for everything that you guys have gone through, and definitely talking about the cultural things as well. I think we don't take that into account when we're dealing with so many different communities. I used to work with the Muslim, Arab American, and South Asian community doing political advocacy. So I'm very familiar with the culture, and it is very closed and tight knit, you know. But it is something that we should try to talk about more. So I want to thank you on behalf of BRCA Strong and on behalf of Tracy, who is taking her little mental health break, because I think we all need that. And I want to encourage all of you guys to jump on our calls. We have a great calendar for October full of events and opportunities to speak with physicians and connect with other previvors and survivors so that we can continue to learn and grow together. So.
Thank you for having us.
Thank you.
Thank you so much. Stay safe, everybody.
Thank you.